did you consider the possibility of toxins, for example, being responsible for Mr. Floyd's cardiac arrest, including potentially drugs?
In the sense that it might have informed our care, yes. There was, again, no report that this patient had, for example, overdosed on a specific medication such as calcium channel blocker or any other medication for which there might be a very specific antidote. And so in that sense, I didn't feel that there was a specific toxin that we could give a medication for that would readily reverse his arrest. Based on the history that was available to me, I felt that hypoxia was one of the more likely possibilities.
And hypoxia as an explanation for his cardiac arrest, meaning oxygen insufficiency.
Correct.
How long was Mr. Floyd in your care in the emergency department?
Approximately 30 minutes.
And at the end of the 30 minutes, did you pronounce him formally dead?
Yes.
At the time you pronounced him dead, was he still in some degree in PEA or asystole in terms of describing his heart?
I think it's probably best to think of these as sort of a spectrum where PEA is some degree of electrical activity still running through the heart, but the heart's not pumping. And then eventually that will devolve into asystole, where both the heart is not pumping and then the electrical activity stops as well. And so at the end of the case, Mr. Floyd was still in PEA, but there was virtually no cardiac activity. And at that point, in the absence of any apparent reversible cause, and because Mr. Floyd had been in arrest for, by this time, 60 minutes, I determined that the likelihood of any meaningful outcome was far below 1%, and that we would not be able to resuscitate Mr. Floyd, and so I then pronounced him dead.
And doctor, was your leading theory then for the cause of Mr. Floyd's cardiac arrest oxygen deficiency?
That was one of the more likely possibilities. I felt that at the time, based on the information I had, it was more likely than the other possibilities.
And doctor, is there another name for death by oxygen deficiency?
Asphyxia is a commonly understood term.
You were discussing hypoxia kind of being consistent with asphyxiation, right?
Correct.
Hypoxia is the lack of oxygen to the brain, correct?
Correct.
Right. And there are many things that cause hypoxia that would still be considered asphyxiation. Agreed?
Correct.
Drug use. Certain drugs can cause hypoxia. Agreed?
Yes.
Specifically fentanyl.
That's correct.
How about methamphetamine?
It can.
Combination of the two?
Yes.
The use of fentanyl, do you know that to attribute to high carbon dioxide levels?
It can cause high carbon dioxide levels because it depresses the ventilation or the breathing.
So when someone ingests fentanyl, it can cause them to feel very sleepy because of an increased carbon dioxide level. Agreed?
Correct.
And that's one of the reasons ultimately that fentanyl is so dangerous, because it suppresses the respiratory system. Agreed?
The primary reason it is so dangerous. Yeah.
When someone has a high carbon dioxide level, that causes that person to have a sensation of shortness of breath. Agreed?
Yes.
And that can happen to a person even without stress complicating their body, right? That respiratory, that feeling of an inability to breathe.
Yes. And administering Narcan to someone who potentially suffered a fentanyl overdose, once that individual is in cardiac arrest, the administration of Narcan would provide no benefit.
You were asked questions just now about whether fentanyl works by causing someone to feel very sleepy. Remember that discussion?
Yes.
Did the paramedics tell you that Mr. Floyd was ever asleep or sleepy or anything that sounds like sleep?
The report that I received was that the patient, Mr. Floyd, was unresponsive on their arrival and did not have a pulse. And so there was no report that he had been sleepy or difficult to arouse per se.